Hello and welcome to another episode of Health Matters, your go-to destination for the latest on health, wellness, and the science behind taking care of your body. Today we're tackling something that's almost every single one of us has dealt with at some point in our life: muscle sprains and strains. Maybe you rolled your ankle, maybe you've pulled your back while lifting something heavy, or you overdid it at the gym and felt that oh so familiar, oh no, tweak in your shoulder or hamstring or back. They might seem like minor problems at first, but muscle sprains and strains can have profound consequences if you leave it untreated. So they actually can lead to chronic pain, limit your mobility, and even emotional impacts like frustration or anxiety. They account for millions and millions of doctor visits and missed days of work every single year. Yet, they are often misunderstood or undertreated. In this episode, we're going to break down for you what sprains actually are, what strains are, the injuries they cause throughout your body, and how they're diagnosed, what the treatment options are, both conservative and advanced options. We'll even look at how you can prevent them all together. So, whether you're an athlete, a weekend warrior, or just want to understand your body, grab a cup of Java and let's dive in. By the end of this episode, you'll have everything you need to know about muscle sprains and strains. So first, let's talk about how common are muscle sprains and strains. I mean, that's really should be the first thing. So, for example, ankle sprains alone account for more than 2 million cases in the US. Ankle sprains, 2 million. Sports injuries, sprains and strains make up the majority of ER visits in youth athletes. Lower back strains, one of the top causes of disability worldwide. Re-injury risk, up to 40% of ankle sprains develop chronic ankle instability. Work-related sprains and strains are the leading cause of workers' compensation claims. That is a crazy stat. So sprains and strains account for nearly 1/3 of all musculoskeletal injuries reported to primary care and sports medicine clinics. 1/3 of all musculoskeletal injuries. That's pretty much what they deal with all day long. So first thing, let's clarify is terminology. A lot of people use the term sprains and strains interchangeably, but here's the thing. They are completely different injuries with different implications. So what is a sprain? What is a strain? So we'll call this segment one. What is a sprain versus what is a strain? So a sprain occurs when you injure a ligament. Ligament is the tough fibrous tissue that connects bone to other bones in your joints. Ligaments are essential for stabilizing your joints and preventing them from moving too far in one direction or another. A sprain happens when excessive force stretches these ligaments beyond their normal ability. And in more severe cases, they can actually tear. Common locations for sprains include ankle, wrist, knee. Those are the most frequently stressed by sharp twists, turns, and impacts or awkward landings. On the other hand, a strain involves an injury to a muscle or tendon, the connective tissue that anchors muscles to bones. Strains often occur due to overstretching, overuse, or direct trauma to the muscle. For example, imagine pulling your hamstring while sprinting or feeling a sharp twinge in your back after lifting a heavy object improperly. Common locations for strains include lower back, hamstrings, shoulders, neck, as these areas endure significant stress during physical and daily movement. I want you to think about this. Think of ligaments like duct tape. holding the bones together to maintain joint stability, and muscles or tendons like rubber bands, which allow your body to move smoothly and generate force. A sprain is essentially tearing or overstretching the duct tape, while the strain is when the rubber band stretches too far or snaps altogether. So, real quick, sprain, ligament, strain, muscle. Very different. So what happens inside your body during a sprain or strain? So during a sprain, ligaments are, which again are made of parallel bundles of tough collagen fibers designed to provide strength, flexibility when stretched. A sprain happens when exercise forces causes these fibers to overstretch, leading to micro tears or worsen or even a rupture in severe cases. The result, pain, swelling, instability, and difficulty moving the affected joint. During a during a strain, muscles are muscles are composed of long, fibrous, organized in bundles called fasciculi, which contract and relax to make movements possible. When these fibers are overstretched or forced into bear more weight than they can actually handle, they develop tears. Strains can also damage the tendons that connect the muscles to the bones, particularly fragile spots, including the enthesis, which is where the tendon actually attaches to the bone, an area highly susceptible to injuries under high loads of tension or stress. So one thing you can take as a takeaway is sprains are failures in the body's joint support system, while strains are mechanical failures in the muscle system that drives movement, aka engine failure in muscles. So now let's talk about segment two. Segment two is going to be the types of sprains and strains. We often characterize muscle sprains and strains based on the severity. These categories also guide how treatment is approached. So the types of sprains, again, sprains, ligaments. Okay, so grade 1 sprain, mild damage to the ligament, minimal pain, and joint instability. Grade 2 sprain is moderate tearing of the ligament, noticeable joint instability, and swelling. Grade 3 sprain, complete ligament tear, severe pain, and significant instability that may require surgery. Now let's go to strains. Again, strains equal muscle or tendon. So first degree muscle strain is mild overstretching or tearing of the muscle, minimal swelling and discomfort. Second degree strain is partial muscle tear, moderate pain, swelling, and loss of strength. Third degree strain is a complete tear of the muscle, severe pain, and loss of function, often requires surgery. Okay, segment 3. Let's jump into it. It's going to be the anatomy of muscle sprains and strains. To appreciate the complexity of these injuries, we have to go deeper into the anatomy of the muscles, ligaments, and tendons surrounding the tissues. So key anatomical areas, muscles. Muscles are made up of fibers that contract and relax to produce movement. Injuries occur when these fibers are overstretched or tear. So muscle strains are organized like cables. So with the cables, you have the outer sheath. The outer sheath is the epimysium. You have the middle sheath, which is the perimysium, which are the bundled fasciculi. And then you have the individual fibers, which is the endomysium. Muscle fibers contain myofibrils, which have actin and myosin filaments. Tendons, on the other hand, which connect muscle to bones, are prone to strain injuries at their insertion points. Tendons, think rope like cord attaching muscle to bone. And their transition point, which is the enthesis, is extremely vulnerable. Ligaments, think sprains, are dense connective tissue, mostly collagen. They run in parallel bundles for tensile strength. They're tough connective tissue that stabilizes joints, prone to sprains when the joints are forced out of position. Example, your ACL, your anterior cruciate ligament, keeps your shin bone from sliding forward. Okay. So I know I mentioned this word a few times, which leads us right into segment 4, which is what is the enthesis? I put it in here because I think it's important to understand what it actually is so you understand where you can potentially get injured. So the enthesis is a crucial anatomical structure that serves as the attachment point where a tendon or ligament connects to the bone. It is more than just a connection. It is a highly specialized area that absorbs and distributes mechanical stresses during movements. The enthesis can be found at various attachment sites throughout the body, particularly in areas subjected to repetitive forces, such as the Achilles tendon. The insertion is at the heel bone, which is your calcaneus bone. The patella tendon attachment is at the kneecap, which is the patella. Ligament attachments at the spine, pelvis, and joints are also very vulnerable. So the question is, why is the enthesis so vulnerable? The enthesis is uniquely structured to handle high levels of tension and compression, but certain factors make it very susceptible to injury. So high mechanical stresses during intense physical activity, running, jumping, and lifting, the enthesis absorbs significant pressure. Overloading these areas can lead to micro tears and inflammation at the insertion site. And obviously, the bigger the injury, the bigger the tear. Age-related wears. As we age, the collagen and supportive tissue in the enthesis becomes less elastic, increasing the risk of damage during repetitive use or sudden movements. That's why as your weekend warriors become into their 40s and 50s, they might try to do something they did in the 20s and 30s, and they might have a tear now. They might have ran too fast, ran too far, jumped too high, and when they landed, they landed in a way that you exerted too much force on the joint, and therefore it tore because your elastic fibers are 45 and not 25. And even though we all feel like we're 25, the body and the ability for it to absorb and function is a little bit different. So the amount of elasticity, fluid in the joints, everything changes a little bit as we age. Degenerative conditions, issues like tendinopathy, which is a disease or dysfunction of the enthesis, can arise from chronic inflammation, overuse, or autoimmune conditions like psoriatic arthritis or ankylosing spondylitis. Lastly, but why is it vulnerable? Repetitive stress injuries. So activities or jobs that involve repetitive motions like running or manual labor place constant stress on the enthesis, leading to overuse injuries. What happens when the enthesis is injured? When the enthesis is injured, it can cause pain, swelling, and dysfunction in the affected area. This type of injury often falls under strain injuries since tendons are involved, but it could also be linked to broader inflammatory or degenerative conditions. Common examples include Achilles tendonitis, which is pain and swellings at the enthesis of the Achilles tendon, patellar tendonitis, aka jumper's knee, which is a strain at the enthesis at the patellar tendon from repetitive jumping or running movements. Plantar fasciitis, which is irritation where the plantar fascia attaches to the heel bone. So right underneath the heel of your the heel bone, which is your fat pad. Underneath there is where your plantar fasciitis is. Importance of the enthesis. So since the enthesis forms the interface between tendons, ligaments, and the skeletal system, it is often involved in strain, injuries, or degenerative ligament or tendon issues. An understanding of this structure is vital for pinpointing pain and addressing injuries that are related to overuse, aging, or systemic inflammation. Next segment 5. We're going to break down how sprains and strains affect the body by region. So in your neck, you could have strains, whiplash in your neck. You could have tech neck. You could have trapezius strains, sprains. You could have cervical ligament injuries after accidents affected by stiffness, headaches, or reduced mobility. In your mid-back, less common for sprains, but muscle strains in your rhomboids, your lats, and your rectus spinae can happen. They can also mimic rib pain and breathing discomfort. In your lower back, strains affect stability muscles like the rectus spinae, often from lifting or sudden twist movements. Most frequent strain site is your lower back, caused by lifting, twisting, or poor body mechanics. Muscles, your recti spinae, your quadriceps lumborum, all have strains available, and they can have pain and spasms, and you could actually miss work from it. In your arms and shoulders, especially during high impact activities like sports or falls, shoulders, the rotator cuff muscles and tendons are highly susceptible to strains from overhead movements. Strains, biceps, rotator cuff, sprains, the UCL ligament in your elbow, which is common in pitchers. You can typically have with this weakness, reduced ability to throw or lift objects. Legs, especially during high impact activities again, like sports or falls. Strains, hamstrings, quads, and your calves, especially in runners and sprinters. Sprains, ankle ligament tears, most commonly worldwide. Okay, so you might say, okay, Doc, or how does this really affect my life? That leads me right into segment 6, how do muscles, sprains, and strains affect your life? So a sprain or strain might seem like a simple injury at first, but it impacts often far beyond just the physical discomfort. These injuries can be profound and affect various parts of your life: physical, emotional, financial. Depending on the severity, let's break it down. Your physical impact. Sprains and strains directly impact your body's ability to function properly, interfering with everything from mobility to daily activities. If you leave it untreated, these issues can compound over time, leading to chronic conditions, impaired mobility. So the inability to perform tasks that require basic movement, such as walking, lifting, or even climbing stairs, can hinder independence. Severe injuries can leave someone relying on crutches, braces, or even caregivers. Physical impact: pain, swelling, and stiffness. These common symptoms limit movement and flexibility, often require prolonged healing time and rest. Chronic pain and discomfort. If prolonged conditions occur and it's not properly managed, a seemingly minor strain or sprain can lead to long-term chronic pain or functional deficits. For example, a poorly rehabbed ligament sprain could lead to joint instability and therefore increase your risk of arthritis. Well, you might say, well, how does that happen, Doc? Okay, here's how it happens. You sprain your ligament, your joint isn't functioning properly, your ability to track your joints and move properly is impeded. It's changed, right? Your biomechanics change. Once your biomechanics change, your body changes the way it moves a little bit. When you change the way you move a little bit, you're not functioning optimally. By that, your body starts to wear and tear differently than it normally should. So you might have shifted your body a little bit, and now you're leaning on one side more than the other, which is why you're going to spike the arthritis. Recurrent muscle strains can cause scar tissue formation, reducing overall strength and flexibility. So if you have a tear in your muscle, strain, or one of your ligaments, and it heals with scar tissue, that area that was strong because it was a solid muscle now has laid down scar tissue to heal that tear, right? To heal that tear, you might have laid it down, and it might be laid down crisscross, it might be laid down upside down, or it might be laid down perfectly. Probably not perfectly, but because of that, your strength in that area has been forever decreased. Increased risk of re-injury. So often injured areas, muscles or ligaments, which are generally weaker, making it more vulnerable to further damage. For example, an untreated or unrehabbed ankle sprain can result in chronic instability or repeated strains. In athletes, re-injury can lead to a cascade of dysfunction as they overcompensate for other body parts. Sleep disturbance from pain. So persistent discomfort, especially at night, can interfere with restful sleep, which is critical for tissue recovery. You need to have at least, I'm going to say 6 to 8 hours at bare minimum for sleep to get your REM cycle going, to get your body to rejuvenate at night. So that was all physical impact on your daily life. Now let's talk about your emotional and mental impact on sprains and strains. The effects of sprains and strains aren't limited to just physical. They also take a significant toll on emotional well-being and mental health, especially as recovery time stretches beyond initial expectations. Frustrations and anxiety. Losing the ability to move freely or participate in your normal activities can be deeply frustrating. There are often fears about whether you will ever fully recover, which can create a sense of hopelessness over time. Example, a recreational runner sidelined with a calf strain may feel anxious about the possibility of losing fitness or falling behind in their training. And as you go, as you fall behind on training, you gain weight, you change your routine. Once you fall out of your routine and what you normally do, it starts to affect you. Am I ever going to get there? Am I ever going to go back? Then 1 week becomes 2 weeks, 2 weeks become a month becomes 3 months, and then before you know it, it's 6 months later. Now you're not back in it. And you're like, why? What happened? What did I do? It was just a sprain. That changed everything for you. And that's how fast it could be. So another condition could be depression or isolation. Chronic pain or limited mobility can lead to withdrawals from social activities. Being unable to participate in outings, sports, or recreational hobbies can leave lasting emotional marks. For athletes, the loss of competition, you might have lost the team camaraderie, or scholarships can feel like a sharp, major life setback. Prolonged inactivity or missed work can lead to feelings of uselessness or lack of purpose. Fear of re-injury. Recovering from a significant sprain or strain can leave people overly cautious or fearful of returning to physical abilities. The avoidance can reduce overall fitness levels, further compounding physical challenges. Financial and life consequences of sprains and strains. You might say, oh, doc, what are you talking about? Are you crazy? Maybe, but beyond the physical and emotional tolls, sprains and strains can have a tangible financial lifestyle. Doc, how? I don't understand. What are you talking about? Okay, so here we go. Especially if the injury is severe or healing is prolonged. So the biggest consequence is lost work days. Many people with sprains or strains find themselves missing work due to pain or mobility limitations. For jobs that require physical labor like construction or caregiving, these injuries can result in weeks or even months of forced downtime. So I have this every day in my office where you'll have a patient who, honestly, let's say he's a 45-year-old patient, bent over to pick up a piece of paper, instantly caused major back spasms, tons of back pain. They come in, they say, Doc, I really didn't do anything. I just bent over, I picked something up. I twisted when I picked it up, and then when I came back up, it hit me. And now I can't straighten up and I can't move. That patient is what we call is has a hot back condition. Those muscles were over. Sometimes it just takes that one little position that you change, that one little thing you do, and your body reacts in a way. It's the fight or flight inside our body. So you put yourself in a perfect position to injure it. Even though it wasn't stressful, it wasn't forceful, it wasn't heavy, but your body reacted and it tightened you up. It's going to try to protect you. And by protecting you, you cause those muscles to actually tighten up and cause a lot of pain, and you can't straighten up. So that means you can't get to your job. Your job is 35 minutes away. You have to drive. You can't get in your car to drive because you can't do it for 35 minutes. Never mind that you can't sit in your desk for 8 hours as you're typing on the computer because you can't sit in that chair. So that person has to be out of work for 1 week, 2 weeks, 3 weeks, 4 weeks, whatever it is to get your body to calm down enough for your muscles to actually start functioning again. You're also going to have reduced productivity, even if you're physically able to work. Distractions from pain or activity restrictions can limit production. Example, a wrist strain might make typing difficult for office workers, while low back strain can reduce performance in manual jobs. So even if you don't have that hard example that I just gave you, you tweak it, it hurts to bend, hurts to twist, hurts to lift. Your ability to do your daily tasks, even out at that job, becomes highly difficult, and your productivity will be down. You're focusing on the pain because you just don't want to have it anymore. You might have lifestyle restrictions, so the injury may limit participation in personal hobbies and recreational activities. For active individuals, being unable to train, compete, or exercise regularly can lead to frustrations or feeling of stagnation. For families or caregivers, a person who is injured may struggle to take part in routine household duties, child care, and other responsibilities. I know for me, if for whatever reason, and yes, it happens to me, it happens to everybody. I'm human just like everybody else. You have muscle sprains and strains. When I can't work out or do my normal daily routine, I am highly frustrated. I am very, very regimented, and I need to do A, B, C, and D because that's how I've structured my life for me. I don't like to break my structure. I don't like to break my routine. Why? For me personally, I feel like if I get out of my routine, it's too easy for me to say, no, I'm not going to go to the gym, or no, I'm not going to exercise, or no. And that no can continue over days, weeks, and months. And I don't want that to happen to me. I'm very focused on my physical well-being for my all-around well-being. It's my go-to stress releaser and my go-to point for feeling good. You know, at the end of the day, we all want to feel good, and that really does help me feel good. So let me give you some takeaways. Sprains and strains are injuries that extend far beyond physical. It's not just about pain, but how it alters your daily life, your mental health, and even your financial stability. Whether you're an athlete whose career is on hold, a worker who is missing valuable work time, or simply someone missing out on your favorite hobby, it is essential to address the injury in its entirety. Getting treatment is not just about healing, it's about reclaiming your life by understanding and actively managing the broader implications of these injuries. You can minimize their long-term impact and work towards a full functioning and steady recovery. Okay, segment 7, causes and risk factors of muscle sprains and strains. Muscle sprains and strains are incredibly common, but what makes them occur most injuries stem from a combination of preventable causes and underlying risk factors. Apparently, my ability to speak was just there. Understanding these triggers can help minimize your risk while improving your physical health and performance overall. Let's take a look. Common causes of muscle sprains and strains. Overuse injuries. Repetitive motions like running, lifting, or throwing can lead to an injury over time, especially if the activity is performed with poor technique or without adequate rest. So, for example, a marathon runner might develop calf strains from repeated stress on the muscles, or a worker who works in a warehouse lifting heavy objects all day can have back strains from that, and that's overuse of the back strains. Second condition we'll talk about is sudden movements and awkward landings. So quick changes in motions like sudden stops, starts, or shifts place stresses on ligaments and muscles, increasing the likelihood of injuries. For example, landing awkwardly on an ankle during a basketball game could cause a sprain, or twisting the torso without stabilizing properly might strain the lower back muscles. If you're an athlete and you're playing football, sudden stop and go and twist, that can easily be very, very awkward. Okay, next let's talk about poor warm-ups or lack of preparation. So when I was young, everybody warmed up. Everybody, you had to stretch. You had to stretch. You had to stretch. That was instilled in me from very, very young. As I got older and as I started coaching my children to play, I always stretched. A lot of the other coaches that were maybe a little younger than me, they didn't stretch as much. And that wasn't something they did. They changed a little bit. And over time, I've noticed that a lot of student athletes do not nearly stretch as much as they used to. So they're instilling into them the lack of preparation by not letting them stretch as well as they should. So not adequately warming up before physical activities leaves your muscles and ligaments stiff and susceptible to injury. Warm-ups help increase circulation and prepare your body for sudden movements. Going straight into, for example, like if you were going to go straight into sprinting without stretching, your hamstrings could easily pull. At the end of the day, it's critical if you're an athlete at all. You have to stretch. You gotta get the blood flow. You gotta get your muscles moving. Those rubber bands that we talked about, you have to get them stretched in order for you to have an adequate run or an adequate event at whatever sport you're doing. Next, we'll talk about traumas or accidents. Sudden external impact. So if you have a fall or collision during sports or in your daily life, can cause muscle strains and ligament sprains. So for example, falling on your wrist while skiing or colliding with another player on the field could result in ligament damage or muscle tears. So I had three. So about 5 years ago for me, I tore 3 ligaments in my knee: my ACL, my anterior cruciate ligament, my medial collateral ligament, and the meniscus. I had a partial tear on all of them. It's called the unhappy triangle. And I did that skiing. So that is definitely, it definitely affects your life. It definitely changes it. But I did heal it in a pretty cool way, and I'll tell you about that when I'm in the area about treatment. Overstretching, last part. Forcing muscles or ligaments beyond their natural range of motion can lead to tears at the microscopic or macroscopic level. For example, attempting to stretch into splits without properly flexing could result in hamstring strains. So you can't just, if you're a gymnast, you can't just jump into a split. Your hamstrings, your muscles will definitely tighten up on you. Okay, next, let's jump into the risk factors that predispose you to muscle sprains and strains. So first, let's talk about sedentary lifestyle. So lack of physical activity leads to muscle weakness and poor joint stability, increasing the risk for sprains and strains during sudden or strenuous movements. A sedentary individual lifting heavy groceries or doing yard work without conditioning may pull a back muscle or twist an ankle. So obviously, if you're going out to get groceries, you're not going to sit there and do 15 minutes of stretching. But if you know something's heavy, you might want to take 1 or 2 minutes just to do some light stretching just to get you warmed up. Or you might want to make 2 trips instead of one. Poor posture or biomechanics. Improper movement patterns like poor postural alignment or biomechanical imbalances like flat feet or weak gluteal muscles place uneven stresses on muscles and joints. Over time, this can cause strain injuries. Runners with minimal arch supports may suffer repeated ankle strains, while people sitting at a desk with bad posture might experience neck strains or lower back pain. Inadequate conditioning or muscle fatigue. So muscles that are overworked or underconditioned are more prone to injury. Fatigued muscles cannot adequately supply healthy movement patterns, leading to poor form or instability. After an intense workout, fatigued legs may fail to stabilize the knee, leaving the ligaments vulnerable during sudden movements. Next, we're going to talk about age-related muscle changes. As we age, muscle fibers and tendons lose their elasticity and strength, causing a decreased ability to absorb stress and recover from strains. Older individuals may develop Achilles tendonitis or muscle strains in the back or neck more easily while doing everyday activities like gardening or climbing stairs. Sounds like it's impossible, but it happens every day in my office. Existing muscle imbalances. So weak or overused muscles can create imbalances, increasing strains on ligaments and surrounding tissues. An athlete with strong quads but weak hamstrings might experience hamstring strains during explosive movements like jumping or sprinting. Hypermobility or joint lax. So individuals with hypermobility, so there are some patients that come in and they are hypermobile. They can move their joints beyond where they should go. Or you might have conditions like Ehlers-Danlos syndrome, which are genetically loose ligaments and are higher risk for ligament sprains and muscle strains because of the joint insufficiency. A hypermobile shoulder may dislocate more easily, leading to strains in the rotator cuff muscles while trying to stabilize the joint. Incomplete rehabilitation following a previous injury. So when an injury hasn't fully healed, the affected muscle tendons or ligaments are weaker and more vulnerable to re-injury. Rushing back into sports after an ankle sprain increases the likelihood of developing chronic ankle instability, which makes future sprains more likely. What are the causes and risk factors? Many injuries arise when these causes and risk factors overlap. For example, a sedentary person rushes into an intense workout without warming up, leading to hamstring strains. A runner with poor biomechanics may experience repetitive stresses on the knee, resulting from a sprain of the ACL. Final takeaway for this segment I want to tell you is preventing muscle sprains and strains require proactive attention to movement patterns, fitness routines, and risk factors. Understanding what triggers these injuries, combined with targeted preparations like warming up, improving muscle strength, and correcting biomechanics, can significantly reduce your chances of dealing with these painful setbacks. Segment 8, diagnosing muscle sprains and strains. So diagnosing a sprain or strain may seem straightforward when you're experiencing pain and limited mobility, but it's not always as simple as it appears. Many of the symptoms, such as swelling, bruising, or stiffness, can overlap with other injuries, including fractures or dislocation. That's why a thorough diagnostic process is essential for accurately identifying and grading the injury, evaluating its severity, and ruling out other potential problems. Proper diagnosis often involves a combination of clinical evaluation, specialized tests, and imaging techniques. Let's explore. Your clinical exam. So your healthcare provider, when doing their exam, will usually begin with a clinical exam. So they're going to look at the swelling and bruising. So your swelling are they're the outward signs of an injury, which help obviously pinpoint where the injury is. While both sprains and strains can cause swelling and discoloration, bruising may be often more prominent with these severe sprains or partial tears in the muscle. The presence of a significant swelling or bruising around the joint may indicate ligament damage, while localized bruising in a muscle might point to a strain. Your range of motion. Testing how far you can move the injured joint helps determine the extent of the damage. Reduced range of motion is common in sprains due to the instability and swelling, and strains during muscle tightness and pain. Strength testing. Assessing strength tests by utilizing strength techniques to basically, we have muscle testing techniques to identify whether your arms are weak, whether your legs are weak, whether your neck is weak, and we can assess if you have a mild, moderate, or severe injury. So a sprain, weakness in the joint, especially in the ligaments that are partially torn. So you will have a significant difference from one side to another to see what's happening with those muscles. And we also have specialized tests. So we have orthopedic tests to determine ligament sprains or strains, especially in the knee. Patient history. Understanding how and when the injury occurred is critical part of the diagnosis. So the mechanism of injury, how did it happen? Did you twist? Did you hear a pop? Was there an immediate swelling or bruising? Understanding what happened in the moment helps determine whether the injury affects soft tissue, bone, or both. Onset of symptoms. Was the pain immediate or did it develop gradually? Acute injuries. Failing during sports. Was there trauma? Pain levels. Do you have sharp pain? Do you have diffuse pain? Do you have minimal pain? Another thing we're going to look at is history of previous injuries. Previous injuries make you more susceptible to repetitive sprains or strains. Imaging techniques. So if the clinical examination and patient history suggest soft tissue injury, but leave doubt about the severity, imaging testings are the next step to confirm a diagnosis, guiding treatment or to rule out more serious issues. X-rays. Purpose to rule out fracture or significant bone damage. Why is it needed? Sprains and strains generally don't appear on X-ray, but X-rays verify that joint instabilities or swelling isn't masking an underlying fracture. Examples. For a swollen ankle, an X-ray would check for bone fractures that can mimic sprain symptoms. MRIs provide detailed imaging of soft tissues, including muscles, tendons, and ligaments, and cartilage. Why is it needed? An MRI is often used to confirm complex tears within ligaments or muscles, helping to identify partial versus complete ruptures. Examples are if you're diagnosed with an ACL tear in the knee or a severe rotated cuff in your shoulder. Ultrasound would be to show dynamic images of soft tissues in motion, helping doctors assess tendons and ligament injuries. Why is it needed? Particularly useful for identifying smaller tears that might not show up clearly on other imaging and is often less costly than an MRI. Identifying red flags. So during diagnostic procedures, a clinician also trained to watch for red flags might indicate more severe conditions that require urgent interventions. So deformity. So visual signs of a joint misalignment or bone displacement out of place, right? So if your bone is completely missed and out of place, that's going to be a big red flags. Inability to bear weight. So if you come in and you can't stand up on or walk on your injured leg might indicate a severe joint sprain or complete tear of the ligament or fracture. Doc, I heard a pop at the time of injury. Hearing a pop is often a sound associated with ligament tears such as the ACL or tendon injuries. Severe numbness or loss of function typically indicates a potential nerve damage, which may require immediate attention. So one of the takeaways for this segment is diagnosing a sprain or strain isn't simply about resting until pain subsides, especially when symptoms may mask more serious underlying issues like complete tears or fractures. If you experience significant pain, swelling, or bruising, or loss of mobility, it is critical to seek out thorough evaluations to confirm your diagnosis, starting with the proper treatment plan. The right care often ensures not just healing, but prevention of long-term complications like chronic pain or re-injury. By carefully assessing your physical signs, injury history, and imaging result, healthcare professionals can recommend an accurate diagnosis and design a treatment plan tailored to your recovery. Okay, segment 9, treatment options for sprains and strains. When it comes to treating a sprain or strain, both conservative and non-conservative approaches can be used depending on the severity of the injury. So let's get into conservative. Conservative treatments are typically the first line of defense against sprains and strains, aiming to alleviate symptoms, restore function, and promote healing without invasive procedures. So immediate care, your first 72 hours. When you first sustain an injury, I didn't make this up. This is something that's out there. The peace and love protocol can be crucial to managing your initial symptoms and preparing for further rehabilitation. So peace and love. P, protect. Shield the affected area to prevent further injury. E, elevate. Raise the affected limb to reduce swelling. A, avoid NSAIDs initially. They might inhibit the natural inflammatory process needed for early healing. C, compress. Use elastic bandages or wraps to minimize swelling. E, educate. Learn about your injury to manage its efficiency and effectiveness. Load is L, gradually reintroducement of movement and weight-bearing activities. O, optimism, positive mindset to aid in recovery. V, vascularization, promote blood flow with pain-free movements. E, exercise, gentle exercise to restore mobility and strength. So that is the peace and love protocol for sprain and strain injuries. Okay, so now let's jump into physical therapy and how they assess sprains and strains. It's essential for both immediate and long-term care rehab. It often progresses into phases. So PTs utilize sprains and strains in phases. So phase 1, initially gentle ranges of motion exercises, isometric stretches, and pain management strategies to reduce inflammation. Phase 2 focuses on progressive strengthening with eccentric exercise, balance training, and dynamic movement. And phase 3 prepares for return to sports or work with sport-specific drills, agility exercises, and strength training techniques. Techniques that you typically use in physical therapy also are ultrasound, manual massage, stretching protocols. Chiropractic care. Chiropractors can address injuries by focusing on alignments and mobilities of the joints, especially of the spine, to help improve overall mechanical balance and reduce joint pain. Joint mobilization restores ranges of motion and reduces stiffness. Soft tissue release breaks down scar tissue and alleviates tension. Proprioceptive retraining enhances body's awareness to prevent further injuries. Typically, when we're adjusting and we're manipulating the spine, we're releasing the areas causing your joints to kind of relax, right? We're giving your joints motion. When you give those joints motion, you're putting them back where they need to go, and you're giving them the proper alignment to help increase that function. Regenerative medicine. Regenerative medicine offers innovative solutions to promote natural healing and tissue regeneration. While still evolving, there are treatments that show promising results for sprains and strains, particularly platelet-rich plasma, PRP. PRP involves injecting a concentrated mix of your own platelets into the affected tissue. Platelets contain growth factors that are crucial for healing. So in our office, we use PRP for ligament sprains and strains. Basically, what that is, we draw blood, we spin it. When we spin it, your red blood cells go to the bottom, your platelets on top. Your platelets are what we call liquid gold. Those platelets have your proteins, your growth factors, your stem cells, all the goodness to heal. We put that into the muscle. That actually heals the muscles from the inside out. It heals your muscles and ligaments from the root up. Okay, so what are some of the non-conservative treatments? In cases where injuries are severe or conservative treatments fail, surgical interventions might be necessary. So grade 3 tears indicated a complete rupture of the tendon, muscle, or ligaments often require surgery. So if you have a complete tear, you need surgery. There's no therapy I can do or anybody else can do that is going to put those back. When you have a complete tear, a complete rupture, you need to have surgery. So surgery might include ligament reconstruction, replace the torn ligaments with a graft, often usually with your own tissue. Tendon repair, whether it's the Achilles or hamstring avulsion, usually involves stitching the torn ends together or reattaching them to bone. So some of the post-surgical rehab would be some of the physical therapy that we talked about. And lastly, pain management, managing pain with either NSAIDs or corticosteroids. When dealing with sprains and strains, understanding the approach treatment is crucial. Conservative treatments like PT and chiro and regenerative medicine offer effective pathways to healing for most injuries. However, recognizing the severity of injuries is paramount. Severe cases you may need surgery. If you have that complete tear, you may need surgery. So you definitely need to consult and seek a comprehensive evaluation from your medical doctor or your chiropractor or your physical therapist or one of those professionals to best evaluate you for the proper treatment protocol. So what are some of the associated conditions and long-term implications? Untreated sprains and strains can lead to significant complications over time, like chronic pain syndrome. So persistent pain from untreated muscle damage usually leads to chronic lower back pain from recurring strains. Arthritis. Joint instabilities from ligament injuries can increase wear and tear with early onset osteoarthritis to the affected areas. Tendinitis, chronic inflammation of tendons from repetitive strains. Tendinopathies could happen in your Achilles or patella. Long-term impacts could be permanent loss of mobility, reduced strength and endurance, and increasing your ability to re-injure yourself. So we're going to wrap this up. Sprain and strains may be common, but they are more than just minor inconveniences. They're signals from your body that something is out of place. When left untreated or ignored, these injuries can lead to chronic pain, limited mobility, and even decreased quality of life. But here's the good news. With the right knowledge and proper diagnosis, a structured treatment plan, you can not only recover, but also prevent further injuries. Understanding sprains and strains puts you one step on the path of prevention and long-term recovery, whether it's a wrist sprain, a lower back strain, or anything else in between. Acting early, sticking to a consistent rehab plan, and paying attention to your body can dramatically improve your quality of life. Here's something I want you to think about. An ounce of prevention is worth a pound of cure. Learn how to reduce your risks of sprains and strains. Okay, so let's go over it real quick. Warming up properly, maintaining strength and flexibility, and addressing any biomechanical issues can help prevent injuries before they happen. So when you warm up, you want to make sure you're warming up the area that you treated properly. You want to stretch regularly to maintain flexibility. You want to keep strength to your muscles. So you want to make sure you're using weights to actually strengthen your muscles to reduce muscle imbalances. You want to practice good body mechanics during activities. Don't ignore the symptoms. Swelling, pain, or stiffness isn't just something to tough out. These are warning signs that deserve attention to prevent further damage. Commit to recovery. Structured rehab through physical therapy and chiropractic care and proper rest and consistent exercise is essential for healing and preventing re-injury. Stay informed. The right knowledge empowers you to make better choices for your body and lifestyle, whether you're addressing smaller injuries or recognizing when it's time to seek an expert. So I want to tell everybody, thank you so much for joining me. I know this was a long segment and taking a deep dive into muscle sprains and strains. So whether you're an athlete training or someone managing an older injury or somebody simply navigating daily life, taking these insights to heart, proper care and attention to these injuries can make all the difference in not just healing, but also protecting your future mobility and long-term wellness. Life is about wellness, right? So in especially in our office, we focus on wellness, and your wellness is the ability to understand how to be on the right road, right? So a lot of times there's always forks in the roads and which way you go. And your wellness road could be the road that you take to avoid the accident. The accident could be the injury or the condition that you develop, right? So proper wellness, proper take it. If you're in your 30s and you have a certain problem or condition, take care of it now. This way, by the time you're 40 or 50, you don't have a bigger problem. Might seem trivial to you at 30, but it won't seem trivial when you're 50 and you can't do certain things because you have an inability to do it because you let it go too far. Don't do that. Don't be that person. If you know someone who is struggling with sprains or strains or could use a little help understanding their bodies better, please share this episode. Together, we could spread awareness and help more people live happier, healthier lives. And as I always say, the information I've given you today is my opinion alone. If you have a problem, please seek out a healthcare provider to address your personal issues. My information is not meant to be a diagnosis, treatment, or anything for you. It is more for your information. Hopefully it helps give you something to think about. Hopefully I gave you a little bit more knowledge than you had 30 minutes ago. Please support our podcast. I do this simply to help others. The whole purpose of why I do it is to give more information. There is a lot of misinformation out there that people don't understand, and hopefully I could put it in. I give you the anatomy. I give you the whole breakdown. So if you really want to get into the weeds, you can, or you can skip ahead to the area that of the video that applies to you. But if you know somebody, please pass it along. As I always say, stay safe, stay active, stay healthy. You only get one shot at this thing we call life. Your health matters. I'm Dr. Chillemi. Till next time.